single day, like I've always done and always will.
Passing these bills on the floor, making yet another stand.
Welcome to this week's edition of New York Now. I'm Chantal Destra. After months of speculation from political insiders, Governor Kathy Hochul officially announced her running mate for re-election, former New York City Council Speaker Adrienne Adams. In a press release, the governor touted accomplishments made by Adams during her time leading the city council. Those accomplishments include tackling affordability and focusing on childcare in the city. The governor's choice represents the first all-female gubernatorial ticket for a major political party in state history. Hochul and Adams are slated to secure the Democratic nomination at the party's convention this weekend. And prior to the governor's selection, there were a few names of lawmakers and elected officials who were reportedly on the short list for possible consideration. One of those names was Member Brian Cunningham, who represents parts of Brooklyn in the lower chamber. Since coming into office, the Assemblymember has been focused on addressing affordability through housing and securing funding for SUNY Downstate in his district. We spoke with the Assemblymember about his legislative priorities this year and to get his reaction to the governor's selection. Here's that conversation. Thank you so much for connecting with us today, Assemblymember.
Thank you for having me on the show.
Of course, we're excited to dive into your legislative priorities, one of them being a bill that you sponsored that would provide increased protections against deed theft for New York homeowners. What can you tell us about that bill?
Well, New York City, and particularly Brooklyn, has been the epicenter of deed theft. A lot of older residents who have purchased their homes years ago have incredible generational wealth stored up in their homes, are losing their homes because of unscrupulous actors who are literally pulling wealth from them by transferring their deeds. What our bill is going to do is protect those homeowners and make sure we keep New Yorkers here. I think the housing situation is kind of threefold, right? It's one, the affordability crisis of making sure we have rents that are affordable for New Yorkers, keeping homeowners in their homes, which is protecting through deed theft, and also making sure we protect people to become first-time home buyers as well.
And if your bill is signed into law, is there any costs associated with implementation?
When it's signed into law, there's always a win, right? I think obviously there's always costs behind bills. The fiscal is also one of those things that I think is an investment worth making in terms of protecting homeowners. This is property taxes of folks who are longtime residents, and it says that New York is a place that you can not only live here, but you can stay here.
And you've also been pushing for faith-based affordable housing in the state. So how would these type of housing units address housing insecurity across the state?
Well, obviously, I talked about the fact that we have a three-pronged problem, right? There's a supply issue of making sure we create housing. And what we have right now is faith-based institutions, both mosques, synagogues, and churches, who have land and air rights that want to be participants in the economy of helping their residents stay in New York. However, they cannot because of some zoning laws that are outdated and restrictive. What this does is it allows those institutions to create housing with their existing land and allow us to really house people who are in need. Somebody said this morning at the press conference we had, there were 16 New Yorkers who died during our brutal winter storms because they weren't housed. That is something that's a crime on humanity, and that's something that we can address as a city by making sure we create more affordable housing.
So do you have an estimate on how many housing units could potentially be unlocked when your bill is signed into law?
I think in the first year we estimate about 10,000 units of housing, which is obviously a huge number. It doesn't close all the problems that we have with our housing supply, but I think 10,000 units being added and 10,000 more New Yorkers living somewhere safe and affordable is something that's worth, again, the investment of our political power and our political will to make it happen.
And we know, of course, this isn't a new bill. So what is your strategy this year to get it over the legislative finish line and get it finally signed into law?
Well, I think one of the big strategies is obviously everyone is talking about affordability, whether you are talking about affordability from the context of a home or you're talking about affordability in the context of childcare. I think everyone realizes that the cost of living is getting too high in New York, and we want to make sure that every New Yorker has an opportunity for a shot at their home. So I think my colleagues are motivated. I think we're willing to do something. I think there's an appetite this session like never before to get this done.
What are some other ways that you're hoping to address affordability this session beyond housing?
Well, one of the key things, just staying with the housing piece for a second, is our community medium income bill. I think for far too long, many New Yorkers have asked the same question, affordable for who? So we build housing, we subsidize it, we provide tax credits and subsidies, but the AMIs are still too high for the average New Yorker. They look at it and they go, I don't make that kind of money to live there. What we're suggesting, and we have a bill that addresses it, is looking specifically at making sure that we look at the community medium income. So making sure that when New Yorkers are looking at it, whether you live, when you're in the Bronx, that's one income scale. When you live in Brooklyn, that's another thing. Long Island, Buffalo, throughout the state, we have different area incomes. We want to make sure we pass that in the law this year, and I think that will help drive down the cost side in terms of these units.
Yeah, and beyond housing?
Beyond housing, the other big thing is food insecurity. Obviously, we see time and time again, there's so many New Yorkers who still need support when it comes to food, particularly post-pandemic. And also we're seeing a lot of EBT theft rise. And so we have a bill as well to make sure we don't see that happen for New Yorkers, that when people swipe those cards, that we know that that is actually the person who needed those resources and they aren't taking both your housing through deeds and your food through our subsidies.
And another big issue this session is immigration reform. We saw the governor focus heavily on that in her State of the State address. And of course, the legislature has been trying to garner support for New York for All and the Access to Representation Act. So what do you make about the current conversation around immigration policies this year?
Well, obviously, I think the big issue is we're seeing in New York and across American cities, immigrants who are afraid to leave their homes. And it's not an abstract fear, it's literally a fear for their lives. We saw 2 people killed in Minnesota just recently. We want to make sure that ICE agents are held accountable and that we're not using state dollars to help people who are masked, breaking the law, and killing innocent New Yorkers for being immigrants. As somebody who grew up in Flatbush, we talked about this before in one of your previous programs. I am the son of immigrants. I am the son of a Jamaican father who came here, was a cab driver, a mother who got here in 1976 with $36 in her pocket. And we are the epitome of what the American dream stands for, giving people who don't come from here, who speak with a different accent or a different language, the opportunity to be a part of the American experience, the American dream. So protecting immigrants is always something that's deep and personal to me because it's part of my own story.
And what would you say to New Yorkers who are fearful for their own status given, federal policies right now?
Well, I know there's so many offices, particularly our city council friends, who are working specifically to educate people on their rights and giving immigrants the Immigrants' Bill of Rights so they understand exactly if this person does not have a deed. One thing that we are specifically working on, we talked about hospitals in previous segments. In Downstate specifically, I represent 2 of the largest safety net hospitals in the borough of Brooklyn, Downstate and Kings County. We have introduced legislation with our friend Senator Ramos that would protect New Yorkers from being detained at hospitals. While you are getting care, there's no reason to fear that you might be taken out into custody. So that is something that we're currently working on.
And I wanted to ask you about SUNY Downstate because we know that's a university hospital that has had its share of financial woes through the years. Last year's budget provided the hospital with some funding to help with that financial stress and also established a commission to study ways to, address those issues with the hospital. Can you provide us with an update on how things are going?
Absolutely. I'm excited that we introduced legislation last year. We got $1.3 billion in the budget for SUNY Downstate, and that wasn't enough. We're also are working right now on making sure we baseline $100 million every year in the budget until the new facility is complete. I think that's really important because it creates bridge funding for the hospital. We have to remember that during the pandemic, SUNY Downstate was designated as a COVID-only hospital, so other procedures could not be done at that facility. They lost thousands and millions of dollars on medical procedures that weren't administered, as well as the federal Medicaid reimbursement rate has been stagnated for years while costs still go up. So we want to help build that bridge for that hospital, make sure they have the $100 million year over year, build a world-class institution, particularly for children and women with families. And we also want to make sure beyond that, that we also let the city and the state know that we're not going to move downstate by renaming that train station. So when you stop at Winthrop in a couple of months, you're going to hear the conductor say, "You're at SUNY Downstate."
And what level of funding will you be asking the governor and legislative leaders for in this year's state budget for the hospital?
$100 million. We're not taking a dollar less than $100 million. Obviously, more funding, the better, but we believe that at current deficits that we see for the hospital based on the federal reimbursement rates, that we need at minimum $100 million to make sure the hospital continues to operate and we actually see the materialization of that $1.3 billion renovation.
And I wanted to switch gears a bit and talk about some breaking news. So as we know, it was reported that you were on the governor's short list to becoming lieutenant governor. This week it was, unveiled that ex-city council speaker Adrienne Adams was actually selected to be the governor's running mate. What can you tell us about the process of vetting by the governor and how you're feeling in this moment following that news?
Well, one, I'm excited that the governor has a running mate and looking forward to seeing the governor and the running mate out on the campaign trail talking to New Yorkers about the issues that matter most to them. I think obviously not having a full ticket was a distraction for a lot of us. And I think obviously the biggest thing that we take away from this entire process is that there are New Yorkers who are waiting for our government to show up, waiting for a government that's united, waiting for a government who's responsive. And hopefully with this historic ticket, we're excited to see how that plays out in the campaign trail. And the idea is they'll champion not only for women and girls, but also for all New Yorkers, and that little girls across the state, whether you're a black woman or a white woman, can see themselves represented in the highest seats in state government.
And we also saw the Brooklyn Democrats sort of take away their endorsement of Governor Kathy Hochul because of her choosing Adrienne Adams to be her running mate. Any reaction to that news? Well,
I'm in Albany, so I have not heard fully all the gripes with the Brooklyn Democratic Party right now. What I do know is that Brooklyn is the largest Democratic county in the entire country. It is one of the strongest Democratic counties in the country. And obviously, there's a lot of Brooklyn pride in terms of the people that they hoped would have been potentially. My word to Brooklyn is obviously, let's make sure that we elect people that are going to represent our borough and represent our country well.
And what is your mindset heading into the Democratic Convention this Friday?
Yeah, I'm excited. I got a ticket for pretty cheap, $26, an Amtrak ticket going up. Looking forward to meeting with so many folks who I've seen over the last couple of months from different counties in the state. Conventions are always very, very exciting. It renews your not only your party affiliation, but your patriotic obligation to serve. So I'm looking forward to just seeing colleagues from across the state, looking forward to looking at our nomination and our ticket and making sure that we're supportive of them.
Well, unfortunately, that is all the time we have for today, but thank you so much for taking the time to speak with us, Assemblymember.
Thank you so much. Appreciate having you on.
And we were speaking with Assemblymember Brian Cunningham, representing the 43rd Assembly District in Brooklyn. And for more on Assemblymember Brian Cunningham's Democratic priorities, you can visit our website. That's at nynow.org. Now turning to another important topic. The New York State Office of Addiction Services and Supports is responsible for leading the state's efforts to provide resources and help to New Yorkers battling addiction. In this next segment, David Lombardo of WCNY's The Capitol Press Room sat down with Commissioner Chinazo Cunningham. The pair discussed priorities for the office and the current alcohol addiction rates in New York. Here's that interview.
So we're talking during what is known by some as dry January, a month where people who maybe normally imbibe choose not to. And so that's a pretty good backdrop to talk about this pitch that state health officials like yourself have made, which is essentially, hey, New Yorkers, maybe consider drinking a little bit less. Where does that urging come from? Is there reason to believe New York has a drinking problem, so to speak? And also, what constitutes excessive drinking? Because this might be an issue where it's in the eye of the beholder and everyone has, say, a different relationship to alcohol.
Yeah, so, alcohol is the most commonly used substance. Mm-hmm. So that we know, and that's been the case for a long time. We want to make sure that people really understand what healthy or unhealthy use of alcohol is, because I think a lot of times people really don't know. If people around them drink heavily, they may think that that's quote unquote normal, sure, when it can actually have adverse effects. So when we talk really about any substance, there's abstinence, so somebody doesn't use anything. Mm-hmm. Then there's use, but without causing a problem. Then there's more of like the problematic use, and then there's a whole use disorder, or also known as addiction. So when we talk about alcohol, the areas when you start to get into a problem is based on the amount that you drink in one setting or the amount you drink kind of more consistently. And so we talk about binge drinking. So binge drinking for women is 4 or more drinks a day, and for men it's 5 or more drinks a day. And that's so like drinking, within a 2-hour period, something like that. So binge drinking has been associated with adverse effects. So that's a problem. And then sort of heavy drinking, which can be binge drinking, but can also just be more of increased alcohol intake over time. And so for women, that's more than 7 drinks in a week. And for men, that's more than 14 drinks in a week. So both of those, binge drinking and heavy drinking, are associated with problems, even though that might not be addiction or an alcohol use disorder. And then when you go further into more problems, that's an alcohol use disorder. And that's really the hallmarks of any use disorder is loss of control of use of that substance, and then continue to use despite negative consequences. So that's like, once you have 1 or 2 drinks, you really have more and more drinks that you can't control, or, one day you decide you don't want to drink, but you still end up drinking, or you're having problems with work, or your family members, or with the law, or, driving while intoxicated, and you still continue to drink. That's what that addiction looks like.
But in terms of the issue broadly in New York, the stats I've seen that OASAS has put out is that excessive alcohol is one of the leading causes of preventable and premature deaths, citing, I think, 8,000 deaths annually in New York State. Does that represent, say, a common number that we're seeing? Does that represent a new high? Or is this something where we've seen deaths trending? How do you think about that figure?
Yeah, so, things have actually been fairly stable over time. And in fact, less people are actually drinking alcohol. But I think part of the issue is that opioids have gotten so much attention, and rightfully so, because there's been so many opioid overdose deaths. I think what we often are not talking about alcohol enough. And so it's a little bit different. Like, alcohol-related deaths often are not, immediate. They're long-term,
Sure. Right?
Because they cause liver damage, and that causes death over time, or cancers, and then that causes death over time. So we think about them a little bit differently, but there's a huge amount of health-related costs to alcohol that even if you don't die, there's still, a lot of problems with it, and then there's also the death. But overall, actually drinking is going down, but it's still, again, because it's the most commonly used substance, it still has a lot of problems associated with it, including death.
Well, what do you attribute the decline in alcohol consumption to? Is this just about the trend of the so-called Gen Zers who are not drinking? Is there reason to believe older New Yorkers just aren't consuming as much alcohol? And if so, why not?
Yeah, I think there's been shifts in various populations. Like you say, the young people are definitely drinking less alcohol. And that is a trend that we've seen now for many, many years. I think that, people have grown up with understanding some of the problems with alcohol, right? Don't drink and drive, drink responsibly. And, I think that's part of their childhood. That wasn't necessarily part of my childhood. So I think that people now have also understood that a little bit more. Women tend to be drinking more. That's something, again, that's a generational shift that's happened over decades. I think as women are more in the workplace, right? So there have been these shifts in sort of societal norms about alcohol use. But again, it still is the #1 used substance that we have.
Yeah, and so there are still people, though, who have drinking problems, and for those who are looking for help, what is out there? What is the state helping to provide, whether it's outpatient services or even for those more severe cases, inpatient services? What does the network look like? And are there things that you're trying to do now that maybe you couldn't do in the past for whatever reason?
Yeah, so, we think about our whole continuum of services.
Sure.
So we have prevention, treatment, harm reduction, and then recovery. And so we have prevention programming. So prevention programs that happen in schools, colleges, with older people, in communities. And so part of that is just having programs that we know build coping skills and resilience so that people are less likely to use alcohol, for example, to cope with problems. We also have initiatives called SBIRT, which is Screening, Brief Intervention, and Referral to Treatment.
I think you could do better with an acronym on that, but we can talk afterwards.
I didn't make up that acronym.
Sure.
But so when you go to the doctor's office or when you go to the emergency room, you're asked about your alcohol intake, right? That is now happening much more in a widespread way. And so it's it's telling people what the healthy levels are. It's detecting early problems so that we can intervene by counseling and providing education. And that we know is very effective. So we're doing initiatives with that. And so that's the sort of prevention piece. Then we have treatment. So treatment often includes individual counseling, group counseling, and then there's also medication for alcohol use disorder. So there's 3 medications that are approved by the FDA for the treatment of alcohol use disorder.
Well, lastly, on the messaging front, you're telling people maybe think twice about how much you're drinking. At the same time, though, the legislature and the governor have routinely found ways to make it easier to consume alcohol. I still think of the famous meme now of the governor doing the cheers with the cocktails to go. So is that part of the equation that you have to up your, I guess, PR game and be prevalent and be on social media where people are with these messages reminding people, hey, be careful?
Yeah. I mean, I think for any substance that's legal, that is the case, right? So alcohol, now cannabis, gambling, tobacco, right? So we want to inform the public about what is healthy and what is unhealthy so they can make educated decisions. So, our public awareness campaigns have talked about that, especially for youth. And then also really harm reduction, which is, there are ways to reduce your risk and still drink alcohol responsibly. So we hear it all the time around don't drink and drive, or we hear drink responsibly, or, take breaks, drink water between drinks, right? All of those are ways where people can still enjoy alcohol use, but have less risk or less harms associated with alcohol.
Sure. Or liquor before beer, you're in the clear. Beer before liquor, never been sicker. And I want to pivot, though, to an issue that you and I have talked about for 4+ years now, your time as commissioner, which is just broadly the overdose epidemic in New York. And I'm curious, where do you see that fight as we talk in January of 2026? And how does that compare to when you joined the Hochul administration in, say, the fall of 2021?
Yeah, David, we're really pleased by our accomplishments. And in 2025, we really saw New York turning the corner in terms of a reduction in overdose deaths. So there's about a 30% reduction in overdose deaths in the last 12 months. That's 1,800 lives. So that is real, meaningful numbers, individuals, families, and communities. I think a lot of that has to do with harm reduction, so using naloxone. We've distributed, over 300,000 naloxone kits. We also have drug test strips like fentanyl test strips and xylazine test strips, and we've distributed over 25 million of them. We've also made sure that people were aware of fentanyl, through public awareness, right? That fentanyl is out there. That's really what has been driving overdose deaths, and that people should take cautions if you're buying a pill off the internet, if you're using cocaine or any other substance, that fentanyl is likely to be there. We've also expanded treatment a lot. So, for example, in rural counties, we really increased the number of people getting methadone treatment by 50%. That's tremendous. So there's been a lot of efforts, bringing methadone to people through mobile units, having more of the behavioral, the mental health, and addiction clinics. So there's been a widespread effort to really address this in terms of building our system up and out, reaching people who are at highest risk, making sure they have life-saving treatment and tools like fentanyl and drug testing strips. And it's working. We're outpacing the nation in terms of the reduction in overdose deaths.
Well, when you look forward then, is there reason to believe the state is going to be able to keep the pedal to the metal, because there are conversations about resources and what the state can commit and what the federal government is willing to commit, and whether the state and federal government are going to be on the same page as it pertains to things like harm reduction? So what does the future look like, and what are some of the landmines that you're concerned about? Yeah.
We're very concerned about the threats from the federal government. We're very concerned about cuts to Medicaid. We know that will absolutely affect our system. I mean, many, many people who have addiction have Medicaid. So we are very, very worried. I mean, New York has fought back, and won in the courts in terms of, the federal government's tried to cut certain grant dollars coming to us, and they haven't been able to. So there have been wins there, but we are worried. I think one of the things that we've also accomplished is the opioid settlement funds. We've made available $450 million. We've heard some pushback from communities that the money hasn't gotten out there quick enough.
You've heard some of that?
Yes, we have.
Me too.
But we're prepared for this situation because the dollars are over multiple years. So even though we know that the opioid settlement dollars are going down, we have multi-year contracts with programs, so they're not going to see cuts on the ground because they're being funded for 3 years or 4 years. And so that takes some of this, away. And, you can't just stand something up for a year and then let it go, right? And so we've been very thoughtful about how we've used those opioid settlement funds, and they still are there supporting a lot of these services so that the services remain for New Yorkers.
Well, we've been speaking with Dr. Chinazo Cunningham. She's the Commissioner for the State Office of Addiction Services and Supports. Commissioner, thank you so much for joining us in the studio. I really appreciate it.
Thank you for having me.
And for more information on the New York State Office for Addiction Services and Supports, you can visit our website. Again, that's at nynow.org. And now for our last topic. Assembly Minority Leader Will Barclay announced that he'll be stepping down as leader and will not seek re-election. In a statement, the leader reflected on his 23-year tenure in the state legislature and said, quote, "It is the right time for me to move on." Barclay says he intends to step down as minority leader in the coming days to allow the conference to seamlessly select a new leader in the early-ish days of the legislative session. Following the leader's announcement, Assembly Speaker Carl Hastie and members of the legislature on both sides of the aisle shared their support for the leader while celebrating his many accomplishments. We'll continue to bring you updates on the Assembly's new Republican leadership right here on the show. You can also subscribe to our newsletter by going to newsletter.nynow.org or by scanning the QR code on your screen. And that does it for this edition of New York Now. Thank you for tuning in, and see you next week.
Funding for New York Now is provided by WNET,